Please join me in welcoming Brockmann.
Thank you, Jim, for that warm introduction. It really is an honor to be here today, particularly following such an illustrious group of government officials who make me proud to be a newly transplanted Rhode Islander. Thank you, Governor Chafee, Senator Paiva-Weed, and Director Stenning, and thank everyone who pulled this marvelous event together. The Center for Prisoner Health and Human Rights, where I work, has several major priorities. One is the need to get incarcerated women and men proper medical and mental health care when they are in prison and jail, which is a huge problem, not so much here, but it is in the rest of the country. A second equally important goal of the center is to critically examine and undo the criminalization of treatable illnesses and diseases. That society has effectively criminalized mental illness. Right now, the three largest psychiatric facilities in the country are the New York, Los Angeles, and Chicago jails. And we have actually criminalized substance abuse and addiction through the war on drugs, which is really a war on people who use drugs. The center works with world-class researchers at Brown and National who've shown that addiction and substance abuse are in fact treatable long-term diseases. Left untreated, these diseases can lead to activities that lead to run-ins with the law. But we also know that research shows that proper treatment for mental health and addiction in the community substantially reduces those run-ins and is far more effective and much less costly than treating individuals in prison and jail. The center works to turn this research into sensible evidence-based laws and policies that save lives and money. But society stigmatizes and fears the addict, the drug user, the mentally ill, the criminal, and that stigma and fear are reflected in punitive laws that stand in the way of healthy reintegration of individuals with criminal records. And so we are here today to share our stories and let you, our legislators and policymakers, see and hear what works and what we need to provide to others who are ready to turn their lives around. You will hear Tom's story. Someone whose entry to successful long-term recovery came through a pre-trial diversion program for individuals with drug problems. Senate Bill 2270 makes more opportunities for diversion available by expanding the state's drug court, by providing more people like Tom with an opportunity to begin to turn their lives around and avoid jail time and a record if they enter and successfully complete a court-sanctioned treatment program. You will hear stories about unnecessarily losing loved ones to drug overdoses, which is the leading cause of accidental death among adults in Rhode Island and many other states, surpassing deaths from motor vehicle accidents. More overdose deaths in Rhode Island are caused by prescription opioids like OxyContin than all illegal drugs combined. So you will hear Holly's story of burying two young family members who died from drug overdoses. You will hear Elise and Richard's story of losing not one but two sons to drug overdoses, deaths that might have been prevented had the Good Samaritan Overdose Prevention Act that is currently before both the House and the Senate been in effect. We tell our stories because we know that if we don't, there's a very good chance that the newspaper will end up telling our stories for us. Last week, the Providence Journal and the Boston Globe told the sad story of Nicole Cianci's death from a drug overdose. An overdose death that could have been avoided had her roommate been trained in the use of naloxone to counter the effects of the overdose, and had the Good Sam bill been in effect that would have protected him from prosecution had he called 911. There is no reason that this sane, sensible, life-saving legislation should not pass the House this legislative session. You will hear our stories of how existing laws place incredible barriers in the way of successful recovery and reintegration into society. You will hear stories of continuing stigma, of how many individuals who have paid the price for crimes they committed with prison or jail time are forced to continue to pay for their errors, and pay, and pay, and pay, no matter how well they might have changed their lives. We urge you to listen to these stories and support the ban the box legislation, support certificates of rehabilitation, and support sensible measures that reduce stigma and give folks who have really turned their lives around a chance to prove that they can do the job and deserve to be hired. And we're not asking that drug records be ignored. But we are asking that genuine efforts at rebuilding lives be recognized, supported, indeed rewarded with the chance of gainful, meaningful employment. A criminal sentence should not be a life sentence that effectively forces former prisoners into chronic or underemployment. Without work that pays enough to live on, the chances of successful reintegration in society are extraordinarily low. The legislature currently is considering a devastating bill that would close large areas of the healthcare industry to individuals with a criminal record, even a nonviolent drug conviction. It is a blanket prohibition that is overbroad and fundamentally flawed. As you listen to our stories, you will hear about some of the remarkable, gifted people in long-term recovery who are making differences in the lives of others precisely because they were themselves swallowed by their own addictions, their own substance abuse, their own self-destruction, yet they have managed successfully at long-term recovery. They make incredibly powerful and effective drug abuse counselors and rehabilitation specialists who talk the talk in a way that someone who hasn't been through that particular corner of hell simply can't. These individuals are gifts to the community who can help others make their own way to long-term recovery. Not a small number of these effective drug counselors work in or got their start in Director Stenning's agency. A blanket bar to employment without considering the merits of individual cases is the very essence of unfairness, of throwing up ever higher bars to the chance to reintegrate. It is also an incredible waste of an invaluable human resource. We strongly urge you to oppose House Bill 7806. And one last and very important story you will hear and that you have already heard is that the recovery community and its allies vote. Over 7,000 individuals pass through the Anchor Recovery Center each month, and we are grateful that the recovery community in the state continues to grow. The community's collective voice, its collective stories merit your close attention. We urge you to listen with critical, discerning, but open minds, and with a sense of fair play and justice that balances genuine public safety concerns with the need to help people get back on their feet and secure jobs if they are ever to become productive members of society. Perhaps if we tell our stories well, the stories you will hear from us next year, and the year after that will be ones of lives reclaimed and of a Rhode Island that is fairer and more just and ultimately safer because of your actions today. Thank you for listening to our stories, and bless you all.
Thank you so much.